and thanks for watching. So today I have Dr. Brian Moss, and he is an orthopedic surgeon at Orthopedic Associates in Chicago. Hi, Dr. Moss. Can you tell us a little bit more about you and what you do?
Yeah, definitely. Thanks for having me on, Lexi. My name's Brian Moss, and I'm an orthopedic surgeon practicing in the northwest suburb of Chicago called Arlington Heights. And I pretty much have a general orthopedic practice, meaning I see the whole gamut of orthopedic issues in all age ranges. Um, I did do a fellowship in sports medicine where I spent a year kind of subspecializing in sports related injuries and surgery. But that's a portion of my practice. It's not the whole thing.
Okay. So how'd you get into orthopedics?
So, I mean, in general, medicine wise, I kind of grew up in the healthcare field. My
Okay.
dad was a doctor, not orthopedics. My dad was in family practice. And my mom was a nurse. So I kind of grew up in the healthcare field, and that's just kind of what I knew. Um, and despite my dad trying to talk me out of going into medicine, I actually did end up going into medicine. And then when I was in high school, I was active with different sports. I played basketball and football, and I tore my ACL in my knee when I was, in high school, and I saw an orthopedic surgeon who I thought was phenomenal, and he totally made a huge impact on my life. And I said, this is what I want to do within medicine. So from a real early age, because of that orthopedic surgeon, I kind of knew that this is what I wanted to focus my career on.
Wow. What would you say the best thing about being in orthopedics is?
I mean, the best part about orthopedics, there's lots of great parts about it. The surgery is great, the technology is great, the variety is great, but I mean, ultimately, the best thing is helping your patients and watching people um, have their function restored, or watching people, um, you know, get rid of their pain, whether it's with surgery or not with surgery, physical therapy, whatever treatment modalities we ultimately use. uh, The benefit is, in the end, seeing patients happy and getting back to what they want to do.
Do you have like a favorite procedure or like a specialty?
Um, I honestly, I really like the variety. I have a hard time just doing the same thing over and over again. Some guys like that. I don't like that personally. I do. My practice is real heavy on shoulder and elbow,
Okay.
so I do a lot of shoulder replacements and shoulder surgery, rotator cuffs. I do like ACLs in the knees, and I
Mm,
enjoy trauma surgery. I mean, there's a lot of
yeah.
great stuff. It's hard to pick just one thing.
So what would you say is the worst part of working in orthopedics?
The worst part of orthopedics, um, I think, there's a few things that come along with this field, and most of the fields in medicine. Um, I think, obviously it's very time demanding. So you're going to be making a lot of sacrifices, working later and taking care of patients, versus you're going to sacrifice some of the family time.
Mm,
And that's difficult. I think, as a younger surgeon, I mean, I've been in practice now for 6 years. Something that's still hard for me, but is slowly getting better, is kind of leaving work at work and not bringing everything home with you.
mhm.
When you're connected with people and you're operating operating on people, you want everything to go great and smooth, and you want everybody to feel good and not be in pain and not have any issues. And sometimes, you can't control that, and there are issues that come up. And I know when I first started, it was really difficult to kind of turn off work and focus on anything else in life, really,
Mm.
and try and be present with the people, outside of work that I had relationships with. And that does get better, and it's gotten better, but it's still difficult to kind of separate that out.
So Dan Kennedy is a marketing coach, and he says that businesses really struggle in four areas. And he said it's money, time, people, and passion. And so you had mentioned time. Would you say that's the biggest struggle in orthopedics?
What other aspects are there other than those four? Um, it doesn't seem like that profound of a statement to me, but I think, yes, 100% my top four things would be time, 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 and time.
Mm, okay.
I think, I think the passion is there for anybody who's, is in business for themselves. I'm in private practice. I have two partners, and we're all very passionate about taking care of our patients. We were trained to be doctors. We weren't trained to be businessmen. That's kind of something that we learn along the way, and that I'm still learning. So the passion and the people, that's never an issue for us. Money, of course, is going to be an issue to some degree with any business, but at the end of the day, for us, it's time. We just never. There's not enough time in the day. So.
So when it comes to your practice, which age demographic would you say is the hardest to connect with? Like, is it the millennials or the baby boomers?
I think I can swing pretty well with either of those populations. I can connect fine with the geriatric population. I can connect with the baby boomers. The millennials are a little bit harder, but I still think I do okay. For me, it's the kids. It's adolescence. I don't have any kids myself yet, so I don't know like the hottest cartoons and the best Disney movies out. So for me, until I have kids, that's my hardest population to connect with. Everybody else, I think I do okay.
Okay, yeah. So how would your friends and family describe you outside of work?
Outside of work,
Mm-hmm.
I think they would say, I'm fairly laid back. I love to have a good time, very social, go out as much as I can. Love to love to travel, and I very active, big in fitness, and taking care of myself, because I do believe that you should really practice what you preach. So if I'm telling people all day, they need to be healthy and exercise, I feel like I have to do the same.
Okay. Yeah, it sounds like you're such a passionate person. Like that's pretty cool. Do you what would you say gets you out of bed in the morning? Like is it your work that gets you out of bed in the morning? Is that what you're passionate about, like most passionate about, or?
Probably Monday through Friday. That's really what gets me out of bed, because the alarm goes off usually around 5:20 in the morning, and that's really the only reason I would be getting up that early, trying to beat the Chicago traffic. But no, I mean, definitely it's about more than work, right? I mean, at the end of the day, we're just trying to help people as much as we can, and you know, I'm passionate about my practice. Obviously, I've spent half of my life just training to get to the point where I'm at now.
Mm.
So I'm very passionate, obviously, about my career, but then I'm very passionate about family and friends, and maintaining those relationships, meeting new people, forming new relationships. It's not all just about work. Work is a huge part of it. There's no question, but you try and balance things out.
Yeah. Would you say you've achieved the work-life balance? Like, would you say that you've kind of found that harmony that everyone's looking for?
It depends who you talk to, because I just got married a few weeks ago,
Oh,
so
congrats.
if thank you. If you ask my wife, she says that I need to still work on that a lot. I have not reached that balance. I think I'm getting better at it, but I think unfortunately for me, it's always going to be a little bit more slanted towards work. That is until I probably have a bigger family, and then things will probably start to shift, hopefully.
So what's your long-term goal? Like, what equals a successful life for you?
Successful life for me is, taking care of and treating as many people as I can to the best of my ability. I am a realist. I know that I cannot always be perfect, but I think that it really comes down to how did you treat the person. I think it's important because just like in any other profession, we start to get kind of desensitized to what we're seeing on a daily basis. And I just think that you have to remember that in our line of work, people are coming to us because, they need help. They're in pain or they can't function the way that they, used to function. And, it's important to keep that in mind and keep that perspective. And, ultimately, I have to look at myself in the mirror and say, okay, did you treat this person as best you could? And, not just brush them off because you're having, a bad day or you don't think that they're being honest about things or for whatever the case may be. I think I ran a little off track regarding what you originally asked me, but yeah, I just want to do the best I can for people.
That's awesome.
You may have to edit that answer because I think I started rambling a little bit.
No, it's fine because, I think the nature of these interviews is that you're having just a conversation with someone. It's not scripted and it's not, kind of planned out. So I think that'll be something really good for patients to hear. So where can people learn more about you?
If you Google my name, Brian Moss, and you put in orthopedic surgery, you'll find a few sites. I know you're helping us with our site right now. We appreciate that. There's also, I'm on Facebook, Brian Moss Orthopedics. I'm on LinkedIn, but I almost never check it. And then obviously I do have a website separate from my practice that you could find.
Okay, awesome. Well, thank you so much for doing this interview with me.
Well, thanks for having me.